Hi, this is Lydia Danny Osgood, and I'm answering question number one for women's health, which is what are the most important health issues facing women today? So, in page 12 of our textbook, it brings up several issues, and I picked a couple to focus on, and that is poverty, the lack of access to healthcare, unfair treatment of patients based on race, ethnicity, or sexual orientation, and fear of doctors or the medical institution. So, what are the consequences of these barriers and how do they play into women's health today? The first is a passion of mine, and that is maternal mortality. The United States has one of the highest rates of maternal mortality and morbidity is injury, mortality is death in the developed world. So that's countries like Europe and Canada, countries in Europe and Canada. So the first major reason why our rates are so high is poverty and lack of access. So in the United States, the past 20 years, there's been a sharp increase of maternity wards closing. These closures are mostly in rural and already underserved areas, so inner city hospitals and rural hospitals have seen most of these closures. That means women who already are lacking in a lot of resources are forced to travel further for care, which means they don't go to as many prenatal visits as they should. And when it comes time to deliver, they're having to drive hours to get there. And if they're already in a high risk situation or delivering fast, that can be kind of dangerous for mom. The other big issue that I'm going to focus on in this is race. So in America, Black mothers are more likely to experience complications and 3 times more likely to die during or after childbirth than any other race, regardless of health, age, socioeconomic status, or location in the country. This is due to a variety of factors, but the current research is showing the largest is a phenomenon called weathering. This is premature aging at like a cellular level, where when you look at a woman, like a comparable white woman and a black woman, the black woman's cells themselves are going to look older because she's woman under far more stress, um, due to dealing with systemic prejudices that she's encountering on a daily basis compared to the white woman. So that's it for maternal. That's it for maternal health. The next is mental health. Women are far more likely to experience depression, eating disorders, panic disorders, and borderline personality disorders, just to name a few. They are also more likely to attempt suicide, although they are less likely to succeed than men, and that's often due to the methods they choose. So men tend to do it with a shotgun or guns or more violent methods, whereas women tend to use pills or other considerably more reversible methods. So a huge issue of mental health is poverty and lack of access. To treat mental health is expensive, and there are limited options for those who are uninsured or underinsured. There's also limited access to mental health care in general. The country has a huge deficit of providers, beds, clinics, and inpatient beds. And this deficit goes even higher when you talk about patients with Medicaid or no insurance. So where there's already a limited amount of beds for patients that have good health, like quote unquote good health insurance. When you're talking about patients on Medicaid who have no insurance at all, those beds are very limited and fill up really quickly. Which is why you see a lot of homelessness. A lot of mental illness and homeless people or other people who have fewer options because there's nowhere for them to go and limited options for them, which means they are more likely to end up on the streets. Um, as far as race and mistrust of the mistrust of the healthcare institution, mental illness is stigmatized by most ethnicities. This includes not just minority ethnicities, but also white people tend to stigmatize it as well. Um, so you do deal with the stigma issues across cultural barriers. But another layer that provides a barrier to access for minority communities is a layer of mistrust because of things like the Tuskegee syphilis experiment and other things that have happened to not just Black communities, but there's also been plenty done to Hispanic and Asian communities too, depending on where you look, such as the Philippines and Guatemala. Um, there's a long history of bodies of color being used by the healthcare institution to further healthcare without consent. And this mistrust means a lot of minority patients are willing to seek care, especially in something like mental illness, where they're already dealing with the stigma of it. So if they're dealing with an internal stigma, they're less likely to go seek help. The other big issue, something that I'm also very passionate about, is preventative care. This is healthcare that's designed to prevent or reduce the effects of diseases. This is things like getting a physical or a mammogram. And this is a major issue because a lot of people can't even access this basic level of care. One of the reasons is poverty and lack of access. Again, without health insurance or having limited health insurance, accessing any care is difficult, even basic preventatives. A lot of clinics do a lot of things like this for free, but those slots are limited and it requires the ability to get there and be seen, which not everybody has. And even if a patient has insurance, like Medicare or Medicaid, there are limited clinics and providers in many areas to provide primary care. As I said before, rural communities have a huge deficit of healthcare, and so do many inner city places. So they're having to take time off of work and make a fairly lengthy trek, and they're already living on limited resources. And this is a huge problem because poor women are at a higher risk for obesity, diabetes, heart disease, and domestic violence, and all of these are things that can be addressed with primary care. For instance, primary care doctors are often a point of intervention for domestic violence, especially given the lack of mental health access. And as we mentioned before, race and mistrust plays a huge role in people of color going to be seen for primary care. Often, patients of color report feeling that they receive inferior care from medical providers, and when they feel like they're not going to get good care, why would they bother to go? And there is plenty of data backing up that they do have poor outcomes than white patients when you consider all of the demographics being equal, which means they probably are receiving inferior care. There's also, once again, a lack of trust in the medical establishment, especially in the wake of things like the Tuskegee syphilis experiment, meaning that black patients have one of the lowest rates in the country of receiving preventative care. In the aftermath of the Tuskegee experiments becoming public in the 1970s, there actually was a significant dip in black life expectancy because of this sudden mistrust. So people stopped going to the doctor because of the publication of this study. However, people of color, especially black people, are at a huge risk for chronic health conditions such as heart disease and diabetes, meaning that going to get preventative care is very important to stymie these early. So that's my presentation. Thank you guys for listening.